Yeah, you like, maybe most of us like fruit salad or a glass of juice, maybe banana also. But remember, some foods could also interact with your medication. So in this video, I'll be talking about food medicine interaction. Maybe you are taking medicines like antihyperlipidemics, referred as statins, and maybe you might always love to take grapefruit. Remember, these medicines, if they are given with grapefruit juice, usually the grapefruit will block some important enzymes used in the liver to break down the medicine. So what does that mean? That means the liver will not be able to metabolize this medicine. So you'll find more toxicity of these medicines like liver problem and also problems in muscle pain. Okay. Again, for example, you love bananas, maybe, and you're taking maybe drugs like captopril or enalapril for your blood pressure, and you are taking on banana with such medicines. And again, remember, banana is very rich in potassium. And this angiotensin converting enzyme inhibitors, very good antihypertensives. It could also be given for patients with congestive heart failure and other conditions. So what happens? Also the same, this class of drugs cause an increase in your blood potassium level. So what happens? Banana is also increasing your blood potassium level. The same, these drugs increase the potassium level. That means you end up with too much of potassium in the blood. Now that could cause now irregular heartbeats or even muscle weakness. So those of you on this class of drugs I've mentioned, they're called ACE inhibitors. Example like lisinopril, captopril, enalapril, and the others. The other important thing is some dairy products like milk, yogurt could interact also with tetracyclines. At least this one, you can try to make a time gap. Maybe you can take them every between, like you can give an hour or two between the drug and the milk. Another important point is the usual alcohol with diabetic medicines. You see, the problem with alcohol can drop your blood glucose level unpredictably. You don't know. So you see, if you are especially on insulin or in glyburide, glipizide, like sulfonylureas, anti-diabetics, what happens? You see now, again, these drugs will reduce your blood glucose level by increasing the insulin secretion. And I told you, you don't know the effect of alcohol. Alcohol will really drop your blood glucose level. So you will end up in severe hypoglycemia, and you'll notice you'll be having severe or high dizziness, maybe confusion, or you might even faint. So if you are on such medicines, anti-diabetics, kindly avoid alcohol. Another important thing is taking maybe leafy greens, maybe spinach, kale, with warfarin. You see, this spinach and kale are very rich in vitamin K. And again, it affects basically how warfarin works. Usually, warfarin is an anticoagulant. It tries to reduce the level or the active vitamin K in your blood in such a way it tries to give you an anticoagulant. It prevents blood clotting, especially for people with clotting disorders. So if you take too much of spinach and kale, as I told you, they are rich in vitamin K, then they will interfere with the normal work of warfarin. So still you will not get the benefit of warfarin, that is anticoagulation. So there will be more risk for blood clotting. So you don't have to really avoid them. I'm not saying that, but you must keep the intake consistent. Try to reduce their amount, and also it's good to have a consultation with healthcare professionals in this specific matter. So what is the home tech message? It's very important. If you are on any of especially chronic medicines that require to be taken, for example, for a long time. For example, it could be antiretroviral, anti-diabetic, anti-hypertensive, anti-hyperlipidemic, whatsoever. Take time to see if there will be a drug interaction between your medicines and the food. I know this is a heavy discussion. It depends on, it's very different with the type of drugs you are taking, with the type of food preference you have. For such very specific one-to-one discussion, check my bio. I can provide you with a very good structured advice, personalized advice on by doing your medication review. See you in the next video.